Hi, everyone. My name is Jeanette Easton. I'm from Refound Education, and I'm so happy to introduce today. We have Glenn McDonald from Sterling Capital, who is completely on board with supporting the grassroots education initiatives and our expansion and growth. So thank you guys for tuning in and watching, and I am going to um, give him the floor with introductions, and we have a series of questions that people have asked, some of them that were unable to be with us today, and for the follow-up recording. So thank you for coming, Glenn.
Thank you, Jeanette. Thank you for having me today. Thank you, everybody, for tuning in and listening. First off, I wanted to thank each and every one of you for everything that you are doing with taking care of, teaching, and guiding our future generations. It's not an easy task, and so I'm really happy with everything that you guys are doing, and I'm very thankful to be working with Jeanette directly and Refound Education to help provide you with some extra coverages that you didn't think you would be able to get, whether you are a small company as such as one employee to 5 employees to 10 employees to many, like hundreds of employees. So we are here to kind of chat a little bit about, give you bit about, wow, a bit of background about not only myself, a little bit about Sterling Capital as to how we can help out in that regards and help you out whether you are a small company or a larger company. So to get started, a little bit about myself is I've been in the corporate world for many years. I eventually kind of got tired of the corporate world, and I wanted to start working where I could help both employers and employees at the exact same time. So I ventured into the group benefit sector. I felt there was a huge need between what employers were offering their employees and what employees were looking for from their employers. So I took a huge interest in benefits in that aspect. I've now been with Sterling for a little over 2.5 years. Um, some of the reasons why I chose to work with Sterling is one, not only are they Canada's largest independent group benefit brokers, but they do things differently than what traditional brokers do. We are one of the few brokers that are out there that can offer benefits to companies as small as one employee. So if you are self-employed and you are doing your own thing, we are able to help you in that aspect. We do help out other companies much larger as well. But majority of this conversation is actually to help out a little bit more in regards to the grassroots. So basically, our founders many years ago used to work with ADP. Many years ago, when ADP used to have a benefit sector, when ADP kind of transitioned to focus mainly on HRIS and payroll, that's where our founders created Sterling Capital. What they did was when they created Sterling, they already knew a lot of the pain points that companies were having. Those were a lot of them were with customer service. A lot of them were with enrollments, with enrolling a benefits plan, and even right down to like just generic questions that people were having regarding benefits. So what they did was what we started with was we created our technology, which we call our SCB Connect. What our technology does is it actually helps streamline the enrollment process for your benefits plan. So whether you're a small company with only like 4 or 5 employees and don't have like an HR team, rather than having to chase down paperwork or anything in that aspect, we kind of streamline that whole process for you. From streamlining the process, we wanted to focus on what comes after it, which is the customer service side. We all know what it's like where you've got a question regarding a benefit plan or a question as to what your benefits cover. And anyone that's had a benefits plan it previously, you know what it's like when you've got to call one of the major providers yourself and you're on hold. And then from there, you're on hold for 10, 15 minutes. Then you get transitioned to somebody else because that question that you have, they don't know the answer to. You got sent to the wrong department. Then you got transferred to somebody else. Well, what we do is we actually streamline that with our customer service that we provide. So we actually provide you with a direct contact that rather than you having to reach out and contact the provider yourself, you've got a support team directly from us here at Sterling. So any of your employees, they can contact us directly and we can get that response for you. We can get you that answer a lot quicker. What that does is it actually allows you and your employees, especially in the education sector, to focus on what's important, and that's the growth of the company and the growth of the children. So we know that if you've got a question regarding your benefit plan, teaching kids is a full-time job. You don't want to sit on phone over your lunch break just to find out if a certain prescription is covered under your plan. You can shoot us a quick email and we can answer that question for you. We've got direct contact. I like to call it the Batman line to all the major providers. So basically, we get those questions. Majority of the times, we can answer them ourselves. We're legally able to answer those questions. And then if we don't know those answers, we have that direct contact to contact the provider to get you that answer a lot quicker. This way, you're not spending your whole lunch break on hold just to ask a quick question, then them to tell you, I'll get back to you in 5 to 10 minutes, or I'll get back to you in 24 hours. We have those direct answers. So we're able to streamline that process as well. Basically, what we've done is once we had that technology in place to streamline your whole enrollment process where you don't have to chase down paperwork, and then we've got the customer service side, that's when we turned to the major providers and we said, let's do what we can to get the best prices and the best rates for all of our clients. We've basically been able to do that and structure so many different ways that we can actually structure a benefit plan specific to your company's needs and wants. And we do this knowing that one company would have complete different needs and wants to another company. Everything varies depending on where you live, whether you're Northern Ontario or Southern Alberta. Everybody's different areas that they're living in all have different needs and wants to what a benefit plan is. And what we've been able to do is we can work with individual companies as small as one life to hundreds, where we can structure perfect benefit plans that are best interest for you and your employees to make sure that you and your family are taken care of. So that's probably the quickest like elevator pitch I can almost give you regarding Sterling Capital. But I'd love to be able to answer some questions that some of the people have had and go from there.
Hi,
Hi, Vivian.
how are you?
Good. How are you?
I'm just popping on really quick and then I'll probably have to head out soon, but I may have missed this if you mentioned it at the beginning. I was wondering what would like qualify people to join, like what would they need to show as proof that they work with me or whatever? Because a
So,
lot of my staff are self-employed technically, like I pay them as subcontractors.
okay. So
Um,
if you do have subcontractors, there's a couple different ways that you can look at a benefits plan. You can either have them as individual plans where they can actually, like I said, if they're subcontracted through you, they can have their own benefit plan. They don't need
right,
to actually go through you directly.
I
So
see.
yeah, I'm more than happy where we can structure so many different plans that are out there. And the best
Okay,
part is we help the people that never thought they could get a benefit plan before. So
okay,
a lot of times with entrepreneurs, when they venture off to do their own thing, they don't realize that they're self-employed, they're one employee. They think that they can't get benefits. They think that they can't get a group retirement savings plan. Well, we do things different here that we're trying to show them that yes, you can. So
okay.
um, basically with contractors, if you have, say you've got like yourself and maybe 2 employees that are full-time, and then say
Hmm.
they're 3 or 4 are contracted, we can focus on creating a benefit plan specifically for you and your full-time employees that are there. And then it's just basically an introduction to any of the contractors that you have because their needs might be completely different from what you want to offer. So
Okay.
everybody's got different budgets as well that they have to play with. So my job is to actually focus with those individual contractors because they're registered themselves. So I can help them get a benefits plan directly. And it's basically,
Okay.
does that
Okay.
answer your
I
question?
would love to book a meeting with you. So maybe I'll just get your
Absolutely.
info and we can connect. You're in the Laird area, right?
Sorry, you cut out on that.
You're in the Leaside area?
No, so I'm actually calling from Melancton, Ontario. So I'm up in
Oh.
the great big town of Shelburne, Ontario.
Oh, okay.
So I'm like a cross point between Toronto and Collingwood. but
Oh, okay, yeah.
I help service everyone all across Canada. So
Okay.
so
Okay,
uh,
great.
Jeanette's got all my contact information. She's going to be sending out basically all my info to anyone and everyone.
Okay.
Basically, we really help out a lot of the Refound education members that are affiliated with Refound Ed, and so we've got there's hundreds of different ways I can structure a benefit plan
Okay,
for you.
great.
So yeah,
Okay, thank you. I'll be in touch with you soon.
perfect. Sounds great.
Okay.
Thanks,
Have a
Vivian.
good day. Bye, everyone.
Bye, Vivian. Oh.
And also, if you have families that are in need, that are on their own entrepreneurial journey, please refer them, because the more people we can help, the better it is for everyone. I'll dive into some of the first questions. So one of them was, what are the primary health benefits offered by Sterling Capital?
So we offer pretty much everything in regards to that. We offer like your life, accidental death, dependent life, long-term disability, short-term disability, critical illness, right down to all your basics as well. So we offer like your extended healthcare, so paramedicals, prescriptions in regards to drugs, even dental and vision. Those are the bigger chunks, even out of country travel insurance as well. So we take care of A to Z basically in regards to your benefits sector. We even do specialty insurances as well. So we can help in all different aspects regarding a benefit plan. And we've got some of the best partners out there in regards to like PNC and certain specialties that most people kind of want in a one-stop shop. We have all those partners that we are affiliated with that we can give you the proper introductions to make sure you're taking care of every step in every aspect.
That's amazing. The next questions I'm going to put together. It speaks to my heart. How can families use these benefits to support their needs and additionally needs of their neurodivergent children? Are there options for holistic healthcare, such as naturopathic doctors, within the benefits package?
Yes.
So it spoke to me because my oldest is on the spectrum, and we are having there are 4 or 5 years of wait lists for these families that are really need kind of alternative therapies. So I'm really excited to hear about what you have to offer there.
So that's a fantastic question. And I'm glad you asked that. There are so many different plan designs that we can structure around all of the different needs that are out there. A lot of our plans that we do offer, they do offer like naturopaths and osteopaths, audiologists, speech therapists. A lot of people don't realize like even psychotherapists and psychologists are needed not only for their children, but for themselves as well. There's so many different plans that are out there where we can figure things out regarding budgets on what people can afford in that regards, where it adds a little bit of extra security because insurance is there for not necessarily it's there just because it's insurance. Like it's not like car insurance where you have to have it regardless. Insurance regarding the benefits is there for the just in case because you never know when you're going to need it. So the good thing to have that little extra protection in regards to that. Different plans can vary going from like $300 per practitioner up to like $1,000 per practitioner that's available. So everybody's got their own needs. Everyone, depending on what their abilities are, what they're struggling with, they will also have different needs and wants in that regards. It could be psychological needs that need to be taken care of. So we do have aspects in that where we can focus on that. There are certain children that don't really have, they've got speech impediments. Well, there are speech therapists that can help with that. There's audiologists that some kids just don't have the balance that are there. So audiologists come in and they help out with the hearing and the balance to help in that regard. So there's so many different ways that we can help out in that regards regarding a benefit plan. It's unreal. In regards to some of the holistic healthcare, we do have plans that offer naturopaths, osteopath, where some people don't necessarily like chiropractors because they think chiropractor, you just go in, you're getting your back cracked and neck cracked, and that's it. Well, there's a lot more to it where an osteopath can actually help you out more in regards to conventional treatments They can help out regarding osteopathic like manipulation. So it can really help the musculoskeletal like system with relieving pain and tension in a lot of different aspects, rather than just going in and getting your back cracked. So, and I hate to kind of put that in with the chiropractors, but that's the mentality that a lot of people have, is that's all they do, not realizing that there's a huge health benefits with it. Then there's also like homeopath, uh, medical systems based on like plants and minerals. We do have coverages in regards to that, because some people don't like giving prescription drugs to their children. They don't, and they wanted to have a more natural way of healing specific symptoms. And so we do have lots of different structured plan designs that we can help in that aspect as well.
That's fantastic, because a lot of people aren't opposed to Western medicine. They want a more balanced, holistic approach where they're looking at all their options. So it's so great that, they'll start having access to more.
Yes.
Um, the next question is, how many people need to enroll in the benefit package to reduce costs to the next tier? How close are we to reaching that number? So
So
I know that using our collective, we're really hoping that we can, empower the community to
yes.
give us
So what we've done here is we are structuring something kind of specific to Refound Ed members and everything else. So you're going to be getting access to, by being a Refound Education member, sorry, excuse me. Not only will you get access to like enterprise plan designs without being an enterprise company, but we're working out in regards to like how we can best benefit you in regards to like the grassroots education. So knowing that we are smaller companies, it's kind of, we're working together to make sure that we're being able to provide not only the best pricing, the best plan designs, the best packages, and the best rates. So something as small as one employee, you're going to actually be able to get access to plan designs. And this is the best part of us partnering and working together, is something that a company of like 1,000 employees would normally have access to. So not normally, a traditional broker would kind of look at you and be like, here you go, here's your option 1, 2, or 3. That's it. So we've actually got hundreds of different ways by us working together. So the tiered plan, it's not that you're going to get like better pricing the more people that join or anything else. It's, we've already structured kind of a balanced plan design that's out there to give you already the best rates and prices that are there. And year over year, we maintain your account to make sure that we're monitoring it to ensure that you're still receiving the best pricing and the best plan design going forward.
which is amazing because they don't actually give you option 1, 2, or 3. A lot of people were like, come back when you have like 10,000 people. I'm like, oh, we'd like
Yeah.
to hear it sooner than that. So
Yeah.
really
We've
incredible.
yeah, we've balanced it out so this way we can help all the companies. It doesn't matter the size that you are. There's options that are out there. Our plan is to help you out. You're taking care of our kids. Your health is just as important as theirs. So even if your kid is super healthy, but you're not, the kid's going to feel it. If you're super healthy and the kid's not, you're going to feel it. So the best part about having the benefits package is it not only helps take care of you, takes care of your family moving forward.
That's
And
amazing.
the educators are number one things. You don't get as much credit as you deserve. That's for sure. No.
Yes. And when you improve the morale of the educators, it naturally trickles down to our children, and we want all the happy vibes going. So the next question kind of ties into what Vivian said. So who is eligible to enroll in these benefits? Is it limited to Refound Ed members, or can employees and subcontractors also participate? So we had mentioned that, yes, the Refound Education has access to enterprise,
Yes.
but please be sure to share, this with families so that we help each other grow and our numbers swell, because
Yes.
that will help improve our options even more as we grow. I think.
Yes. So no, yeah. So yeah, basically to tie into that, it's not only do we have the relationship with Refound Education. So if you are a Refound Education member and you do have a small grassroots company being affiliated, we do have kind of custom plans that are already kind of like pre-designed to help out in that aspect. Basically, what we've done is I've already kind of pre-structured a lot of similar plans to companies anywhere from like 1 employee to 15 employees. Then we've got another that's kind of 15 employees to 30 employees. Then I've got another plan from like 30, just to kind of give you some almost like benchmarking as to what other companies of your size are offering their employees out in the market. One, to not only make sure you've got coverage and everything else, but if you're wanting to retain any type of employees, or at least know what competitors are kind of offering, I've already kind of pre-done the legwork regarding that. So I'm trying to help out as much as possible. We can help companies, even if you've already got a benefit plan and you just want a second opinion, we can help out in that aspect. But it's open to not only Refound Education members, where we've got a custom pricing and everything else in regards to, but if your husband's got a company, your wife's got a company, you have friends and family, they have companies, and they didn't think they could have benefit plans or anything in that aspect because they thought they were too small in the benefit world, we can help them out in that aspect. So it is open to everyone, because everybody's health is number one. It's healthy life is better for everyone. I mean, all in all.
That is amazing. We're going on a hike. Sorry, don't mind my children in the background. They want to go hiking.
No worries.
So, actually, Tracy had mentioned something earlier before we had started recording, that Scotiabank had some really great coverage. And so if you guys have a booklet or something that you like the options they offer, then please be sure to give it to him, and he can kind of review it and make sure that you're getting something along.
Yeah, the best thing to do is give me a call, shoot me an email. Like I said, whether you're 1 employee or you are hundreds of employees, like counts, everybody's different. Every company's different. If you've already got a benefit plan there, I'll be more than happy. We can do a full breakdown of your current benefit booklet, give you free benchmarking to show this is what you're currently offering. This is what other companies of your size are offering. On top of that, it gives you a free second look to make sure you are getting the best plan designs, you are getting the best rates. A lot of people don't realize that your company actually follows patterns year over year. So I do things different, where I don't just look at your most recent renewals. I actually look at the past couple of years, and I look for those patterns that you and your employees are utilizing year over year, because you might be paying for certain things that nobody's ever used. And then there's other things that you're overusing on that you should probably increase your coverage on, just so this way you can kind of create a more structured and stabilized benefit plan. And so that's my job, to take a look at that and make sure you're taken care of in every aspect.
Well, I just absolutely love that. So okay. So some of the other questions are, what steps should families take to start using these benefits immediately? And I'll couple the other question in there too. Can you provide examples of how these benefits have positively impacted other families?
Yes. So benefits help out in all aspects. It's insurance that's there. It's always there in case you need it. Everybody, hopefully, we all wish we could be perfectly healthy and never need any type of support from outside, but it's inevitable that we always do need some type of help. Good thing is so families can start taking advantage of benefits depending on how small of a group they are to how large of a group they are. We can move pretty quick with getting you some coverage. Say if you're a small company that is a virgin group to the group benefits, you've never had benefits before, we can usually move a little bit quicker. For larger companies that already have a benefits plan in place, depending on what the coverages are that they're looking for, I do the full breakdown and analysis myself. So I take a look to see, and depending on how fast we make that decision, is how fast we can get launched with the new benefit plan. So families can take advantage of it right off the bat. Usually benefits kick in on the first of every month. So say, for instance, today I met with anyone on the call, or anybody contacted me today. By Friday, we had the meeting, we chatted, we discussed some different options and plans. If you liked one of those and we wanted to go forward, we could have you live as early as July 1st. I can move that quickly. So normally it takes a couple weeks before we can make sure that the full enrollment process is done smoothly and the transition is done adequately. For companies that already have benefit plan in place, it would be 30 days from the next month. So if, again, we came to an agreement by Friday, normally we would have to do the full process where we have to give your current broker and provider at least 30 days notice before you're moving over to us. And then we could have you launched for as early as like August 1st. So we can move pretty quickly in that aspect. Examples of how benefits have positively impacted is a lot of families that do have children that have different disabilities or anything in that aspect. They don't seem to realize like everybody's focus. Yes, 100%. I have 2 kids myself, and so focus is what do I have to do to make sure my kids are happy and healthy? That's the number one goal. I also know that it's a trickle down effect. So if I'm unhappy and I'm unhealthy, my kids are going to feel it regardless. So, but if I'm healthy and I'm happy, that's just going to make them healthier and happier as well. So the best cure for anything is to make sure that everybody is kind of on the same ballpark. The happy spouse, happy house, as what used to call it, and everything else is. I'm a firm believer with that with benefits as well. So the way benefits can actually help is, like even when it comes to like back pain or anything else, well, that little bit of tension and a little bit of pressure on the back, well, a quick half-hour massage to relieve some of that pressure and tension actually relieves a lot of pressure and tension mentally, and which also relieves a lot of pressure and tension emotionally and physically. So that passes down to our children and they can actually see it. They can feel it. The people walking past you down the street, they can see it and they can feel it. So there's a lot of big benefits in regards to how it can positively affect families.
That's amazing. And even like the health sector is going to change completely. And I know you guys are so aware of it and you're ahead of the curve. So
Yes.
that is incredible because now you have all these cool new therapies like sound therapy or things to do with mindfulness or so
Yeah.
the more we can expand, I'm super excited.
Yeah.
So I'll jump into, I guess we kind of touched on this. How can the community leverage its collective voice to enhance and expand the available benefits?
Yes. So in that regards, you basically said it bang on. Here at Sterling, I like to say we're a little bit ahead of the curve. So not only is it just from the community, but we actually listen to, because we work with so many different companies and every company is different. We're hearing the voices of the people. Like everybody's actually turning to their employers and they're saying, well, I want this, this, and this. The employers are then turning to their brokers and saying, well, we want this, this, and this. And it's our job to make sure that we're providing adequate coverage across the board. So what we do here is we make sure that we offer a huge array of different practitioners that offer their benefits. A lot more than what your traditional brokers offer. You will normally find with a traditional broker, you'll probably get 6 to 8 practitioners. Well, we've got certain plan designs that can offer up to 18 different practitioners. So a lot of traditional brokers, they don't really offer like naturopaths or clinical counseling or audiologists, whereas we do have the plans that offer those where they can help out in that aspect. So I'd like to say we're quite ahead of the curve in that aspect to make sure that we're giving the best of the best to all of our clients.
That's amazing. The next question is, what are the main challenges families face when trying to access needed therapies and medical services, and how can Sterling Capital help overcome these barriers? I guess a big one that pops to my mind is, do you pay upfront or does it go through the process established by Sterling?
Yeah, so a lot of the struggles that we find that families are facing is with the availability is getting in touch with your family doctor. That's one of the biggest ones. We actually here at Sterling are partnered with a couple other companies such as Dialogue and TELUS Health, where we help promote. Where we know that you don't necessarily have the time to get into see your family doctor. We work with these companies to help out where, say, for instance, like a rash appears on your child's arm. Well, it's 2 a.m. Nobody wants to go to the waiting room at 2 a.m. because of a random rash that's showed up. But we have partners that we've got 24/7 access to put you in touch with someone directly right off the bat. You answer a quick questionnaire over the phone, and they'll basically tell you, be like, go straight to an emergency room right away. Like, yes, go. or we'll put you directly in touch with a physician or for mental health, for a psychologist or anything like that. Because we also know that not only that rash could get taken care of just by a quick ointment that you might have in the cupboard, but it could also be, oh, okay, well, this is what we think it is. Here you go. Here's a prescription, and we can give you a prescription directly over the phone. You can go straight to your pharmacist, get it filled. Some of the other aspects is mental health. You don't necessarily know when a mental breakdown is going to happen. You don't necessarily, you can't call your psychologist right off the bat and say, I need to see you. I need to see you now. Well, they're going to be like, well, I'm booking out 3 months in advance or 2 weeks in advance or three. It's like, this is the next time I can get you in. Well, these 24/7 access where you can have mental health for not only yourself as an employer, but also offer it to your employees that go above and beyond whatever your practitioner coverage is. So if you offer a certain amount for psychologists or psychotherapists, well, if somebody's having a mental breakdown right then and there and they need to talk to somebody right now, you can get on the phone with the 24/7 number and talk to somebody right away, and they can help you walk through your problems. We find it especially over COVID. Nobody wanted to see anybody over COVID. It was lock up, stay in your house, and don't go out anywhere. Don't even wave to your neighbor. You're in lockdown. And we found a huge spike because nobody even wanted to go see their psychologist or physiotherapist or massage therapist because nobody wanted to wear a mask. Nobody wanted to deal with anything. So we saw a massive spike where everybody wanted to do everything online and do it over the phone, over Zoom, like what we're doing right now. And so we've got the partnerships in place to make sure that they're taken care of in that aspect. Some of the other challenges is a lot of them don't realize they have access to a benefits plan. They just don't. They think they're too small of a company and never thought in a million years that they'd be able to get coverage only having one employee or two employees. That it's like, no, we can help you in that aspect. You're not alone. There's others out there that wanted the help, and we've been able to help them. So
That's amazing. I love that you're touching on the time, access. And I do have that question about the financial, sorry, I'm going a bit rogue that popped into my head.
yeah, no worries. It's
I know
okay.
sometimes you have to pay up front, or sometimes
Yes.
you have to just to prepare people to, or do you have a process in which the Sterling absorbs some kind of up cost and then it's part of, I don't know.
Yep. No, that's a fantastic question. So what we do here at Sterling, you do get invoiced monthly what it would be. Basically, when we negotiate, take a look at, I shouldn't say the word negotiate, when we actually create the best benefit plan for you, the best structured, we make sure that whatever it is that your needs and wants are, going by what budget you have and everything in that aspect, you get charged monthly for it. So it's not like it's anytime you go to use something, you have to pay. It's, what that benefit plan does is we do provide you with kind of like an online digital like benefit card. So it goes directly to your phone or your wallet, I guess, on your phone. So if depending on what benefit plan you had, I'm just using this as a random example. So say you wanted like $300 per practitioner. You went in to see a massage therapist. You can show them. Now it depends on the practitioner. So normally what it is though is a lot of practitioners they'll be able to get reimbursed directly from the provider right off the bat. They input your number into the system, it's there. You don't pay a cent out of your pocket. Some practitioners have it where you pay up front, and then all you do is you take the screenshot of your invoice or whatever that bill is. You submit it through either online through our SCB Connect or through the phone app that you have access to, and then you get reimbursed within 24 to 48 hours. We've got a very quick turnaround with reimbursements.
That's amazing, because I know some people are struggling with some of the financial aspects, so that is solid to be able to have some of those images. Oh, one sec, babe. So the last questions are there any upcoming changes or additions to the benefits package that we should be aware of? And I guess you already touched on the cost bracket, kind of around the $300 mark, but are there different budget-friendly options as well?
Yes. So the $300 mark that I'd mentioned, it was actually just in what kind of offering you might want to offer. So yeah, it's not actually what the cost of what a benefit plan would be.
Perfect.
So in regards to changes, additions, or anything in regards to benefits packages, like I said, we like to think we're ahead of the curve. It's not even that we like to think, we know we're ahead of the curve. So all of the changes that do arise or anything like that, we're looking at months and months before any of this actually comes out to the public. We already preemptively look to see what these changes are about to happen, and we make sure that we're covering not only our clients but any of the employees that they're working with. So all of everything's clear communication. We are straight to the point. We don't hide anything. We like to be very clear and upfront. So in regards to the costs, there are so many different plan designs and structures that we can do. There's benefit plans from as little as like $100 a month up to where you can spend like $1,000 a month. Depends on how lucrative of a plan you want. On average, it's you're I can't even say on average because everybody's got a different situation. Every company is different. One company that's 5 employees might have completely different ideas of what they want for coverage as to another company of 5 employees. So we work with all of them at different sizes, and it comes down where it's yeah, some benefit plans are as little as $100 per employee, up to 300, 400, 500. Um, I'd say on average between 200 to 500 would be pretty pretty good spectrum in regards to great coverages
Mhm.
for a benefits plan.
No, that's super useful. So at least people know what they, what their options or some people always like a little buffer space to, because they always think super expensive, but it's really great to know that you have options as low as 100 and as without limitation.
Exactly. It solely comes down to what kind of coverage you want. It's as Tracy, as you mentioned, like previously before we jumped on, like some very massive employers offer these very, very lucrative benefit plans. And a lot of people love those benefit plans. And when they venture out on their own and do their own entrepreneur, um, they don't realize you can still have access to those plan designs. They really don't realize that. And one of the best things is what we've been able to do with working together for Refound Education is I'm able to provide those like enterprise plan designs to smaller companies solely because of the relationship that we're trying to build here to help out our educators and to help out smaller companies and let them realize that they do have help, they do have support. And one of the other things that we didn't even touch on is we can even help smaller companies regarding group retirement savings plans. We've got a full like GRS team that we can help out, and a lot of companies don't realize that having 5 employees that they can offer this. So we're again, we like to say we're ahead of the curve here, where we can help the smaller companies where they never thought it was possible. That there's options, there's availability that's out there.
That's amazing. I'm gonna bring it to the floor.
Oh,
So Tracy has a question.
absolutely.
I did. I wanted to actually talk about the percentage of coverage, and because like
Yes.
the current plan we have that's going to be ending was like 1,500 a year, and then but I think with like chiropractic care, I think maybe it was, I can't remember, I think it was 80%. I know dental's 80, but then
Yep.
I go to my naturopath and it's a bit less. So then my husband will often be like, okay, I'm not going to put that through because it's really not worth what we get back, but we'll put this through. So does it depend on the different practitioners in terms of what the percentage coverage is?
It actually varies as well. So different plan designs have different coverages for percentages. So it's called co-insurance. The insurance company pays X amount, the employee would pay X amount. They range anywhere from like 70% of co-insurance to 100% co-insurance. So it solely comes down to what plan design is specific to your needs and wants. So say for instance, I'm just going to use like a massage therapist because on average, you look at an hour-long massage costs you roughly about $100. So depending on the plan designs, like there are cost-efficient plan designs for benefits that can offer a dollar amount per practitioner throughout the whole year. So there's plan designs that can offer you like $300 per practitioner per year, $500 per practitioner per year, $750 and $1,000. The increments go up. But having that 80% coverage or 100% coverage would vary depending on what plan design you choose. So if you did want a plan where it's like 80% coverage, at least know the insurance company is covering 80% of that $100 bill. So you have to pay $20 out of your pocket to go see them. You got to look at the overall picture as to what kind of coverage you're looking for year over year. Like, what do you spend on dentist? What do you spend on massage? What do you spend on chiropractor? When we can figure out, which I do with you, I actually work with you to figure out what are the necessities. Because one, let's make sure your immediate needs as to what you're looking for are covered. When we can figure out what your immediate needs are as to what you use on a regular basis are covered, then we can figure out what the additional bonuses that you would like to have as a just in case for the rainy day. Okay? So that's my job. And I work with you specifically, especially if you're one employee, it makes it nice and easy. If you're one family, so we can do single coverage. There's family coverage as well. So we can cover full families. And so a lot of people don't realize, like, hubby owns his own hydrovac company or HVAC company, and he's kind of a one-man show installing AC units and doing heating, and does his own thing. And you have your own company and you're doing your own thing and you're one employee as well. Well, there are ways that you can have a benefit plan that covers you and your spouse. And so there are family plans that are available where we can help out in that aspect. So that's
So when you say
gets my
family,
case.
like my kids are grown up, so they've got their own benefits through their own work now. So it would just be my husband and I. So
You would
you-
still be classified as like a family in that regard.
and then whatever, then you get the same benefits under the family plan, even though there's ones that I use that he never uses.
Yep. So say for that, great question. That's a great question. So basically what it would come to, so say if it's $300 per practitioner, you would receive $300 per practitioner and your spouse would receive $300 per practitioner as well.
Right.
So it's the coverage is you get X amount. When it comes to dental, say it's $1,000 for basic routine coverage. Could be $1,500, could be $2,000. It solely depends on what type of dental package you want. But that would give you $1,000 for coverage and your spouse $1,000 for coverage as well for that year.
Okay, that's really helpful because, like, as we're going forward, like my husband never uses most of anything but dental.
Because we're stubborn.
But yeah, he just doesn't use it where I do a naturopath and a chiropractor. So I use my NAP.
Yeah.
But I don't know if it's worth, that may be something we just pay out of pocket because it also depends on, the year. Sometimes I use a naturopath more one year than I do a different year, depending on whatever is going on, right? But dental, we go every 3 months and we get our so there's I guess that's where you kind of sit down
That's where I help.
Conversation and whether it's worth paying the extra money or you just pay out of pocket for certain holistic things you need once you do the math. I guess that's kind of what we're trying to figure out.
And that's where you said it exactly. That's where I come in. And that's where I sit with you. We discuss it. We figure it out together. We structure something because some of the things like it might be beneficial to kind of get. A lot of people kind of look at benefits. They're like, I want the best of the best of the best.
Yeah.
But they don't need it. They really don't.
Yeah.
And so they're looking at it. They're like, well, I want this. And I have to have this because my company gave me this last time. This is what not necessarily needed, not required. Right. You don't need to go that route. There are coverages, like I said, there's some very basic plans that can give you still some coverage where it kind of eases your pocket a little bit, where it's taking care of some of those, because other things, exactly what you said, and you're like, is this trip that was $40 to go see the chiropractor really worth running through my benefits? Maybe I just pay that through my own pocket. But my $100 naturopath, if I'm using it 5 times a year, that's $500 that I might want to send through my benefit side rather than paying that out of my own pocket, especially when everybody's in different financial states. Everyone's got different budgets. Everybody can afford different things. So that's the best part about benefits. And that's what I love about my job is because everyone's different. I never have the same thing over and over again. So that's where I work closely with you directly. Make sure you've got the best coverage that's available.
Okay.
I hope that answered your
No,
question.
that's great. I'm just, I had another
Just-
question, but it's like,
No, it's all good because I myself, I'm stubborn. I wake up, I've got a sore back. I'm like, it's an old sports injury. I can deal with it. Well, day 2, and then I wake up, I'm like, okay, this hurts. I gotta go, and like I got to take it care of. But my girlfriend's the complete opposite, where she'll wake up, she's like, oh, got a bit of pain. I got to book my meeting. I got to go get taken care of, and then I'm like, oh, this is why she's happier than I am all the time. So like, and I don't want to necessarily say it's a male mentality, but we just hate doctors and we hate going to see doctors in that regards, even though we need them. And I see a naturopath. My naturopath's been amazing. I've changed my whole diet, everything, and I've never been healthier, never been happier, and it's all thanks to my naturopath. And never when I was 20 years old did I ever think I would ever need a naturopath. I'll be honest with you. So, and here I am close to 40 and I'm like, they're my best friend. I love them. So
I did have, sorry, one last question. You said we could also offer this to the families in our school. Is that what that was?
no, so
No.
not necessarily the
Okay.
families in your school. It would have to be, they'd have to have their own companies or anything
Oh, okay.
registered. Yeah, it's not just open to the general public.
Okay. Okay.
Yeah, so it's offered in regards to singular family coverage for anybody that's actually a registered company or
Okay. Like incorporated.
yeah, and no corporate company.
Yeah,
Thank you.
perfect.
That was
Okay,
the word I was looking for. I just couldn't think of it. Thank you.
great. Thank you.
No problem.
All right, and so we have Angela.
Hi there. Sorry, I'm late to the Zoom
Okay.
call, but did you already discuss pricing? And is this also for the teachers or not for the teachers? Sorry if I missed it.
No, so what do you mean in the aspect for the teachers or not for the teachers? Are you talking about teachers that are currently on a school board or teachers that are individually like
No, teachers
educational?
for our private schools. We own private schools, right?
Yep. So it is available for private schools and everything in that aspect. So say if you had just the one private school, you can have it as now, are these teachers, are you paying them as contractors or are you
Yeah,
paying?
my teachers are contract workers, yes.
Okay, so I did touch on this, but I will happily go
Sorry.
again. No, it's okay. Don't apologize. So what we do is you can have one specifically for your school directly. You can have, but what we'd recommend is if that teacher is self-contracted, for them to
Yep.
actually have their own benefit plan where I can offer them that type of coverage. We're offering it to all of the Refound Education members as well as families and friends that have their own companies as well, small companies. So if they are contracted, they're incorporated themselves. So we can offer them as an individual teacher a benefit plan. And in that regards, there are, like I said, there's hundreds of different ways I can structure a benefit plan. So each one of your teachers might want a different benefit plan, and that's where I can come in and help out.
Okay. And do you know the price range for the schools?
So everything varies depending on per person, like per employee that's there. There's plans as little as like close to $100 per month up to like $1,000 per month per employee. It solely depends on what type of plan design you want to look for, what kind of coverage you want to offer. Obviously, like there's the entry level plans are closer to the $100. On average, you're seeing normally between $200 to $500 per month per employee. But again, that solely comes down to how lucrative of a plan you were looking for. My
Okay.
job is to actually sit with you, have a discussion with you to kind of see what type of coverage you want to offer, either you and your employees. And that's the job that I do is I work with you directly because your school could be completely different from the other school you own. Whichever you might have 3 private schools that all 3 of them want different needs and wants. So I can structure things accordingly to make sure that they're all taken care of properly.
Got it. Okay. And but everybody needs an ink. They have to have an ink, or it's places that they're contract workers.
So if they are a contract worker, they are usually self-incorporated anyways.
Not always.
So I guess
A corporation. Yeah.
I guess what she means is their sole proprietorship, partnership, and then incorporated is the next level. So would a sole
Oh, yeah, no,
proprietorship still qualify?
uh, it's a case by case basis. Depends on what kind of proprietorship they're actually doing. We got to follow like CRA rules and regulations. So it kind of comes down into that aspect regarding that. So, but Angela, basically the best thing to do is Jeanette's going to release all my contact information.
Right.
Maybe we can jump on a call and we can discuss it individually because it is a
Okay.
case by case situation, and we can help you in that aspect.
Okay. Yeah, sounds good.
Yes. So
Is this,
sorry?
is it the cooperators? Who is this?
No,
Sorry.
no. So I'm with Sterling Capital. So we're one of Canada's largest independent group benefit brokers. We work with all of the major providers across Canada. So
Okay.
yeah, we can help out as small as one employee all the way up to hundreds of employees. Depends on your company.
Got it. Okay.
Yeah, so they cover the health benefits side of things, and then the cooperators we have the discount with. They do
For
business,
insurance.
correct.
Yeah. Yeah, that's right. Okay.
So, okay, so we'll wrap this up. Thank you guys.
Thank you.
Mhm.
So thank you so much, Glenn. Can you please let everybody know how to contact you?
Yes. So Jeanette's got all my contact information at Refound Education. That's probably the easiest way. You can find me on LinkedIn, Sterling Capital Broker.
And for the members to our membership, if you look in the member package, it is there under the, if you just look at the table of contents, and I will be sure to resend so that a good thing that I do when it comes to documentation is on my contacts on my phone, what I do is put Refound Education and then copy paste the link to the member handbook onto your contacts so that when you think, you need access to contacts or information, you have it saved there and with all the links attached. It's really helpful to me so that I can quickly access instead of going through countless emails. So that's just like a little recommendation when it's the information age. Too much info.
Okay.
Okay, that's awesome. Thank you. I will definitely get my husband and I to make an appointment.
Sounds great. Look forward to it.
Thanks.
Thank you so
Thanks
much,
so much,
everyone.
Jeanette, for putting this
Thank
together.
you.
Thank
Thank
you
you.
guys.
Have a good one.
You too. I'm so excited
Bye.
for the future. Thank you, everyone.
Thanks.
I enjoy
Thanks,
your hike.
everyone. Thanks, Jeanette.
Bye.